Hi, my name is Dr. Raylyn Kinler, and today I'm going to be talking to you about finasteride. So finasteride is a medication that we use for prevention of native hair loss, and it comes in two forms, which are both oral and topical. And the finasteride compound itself is actually a DHT or dihydrotestosterone blocker. Finasteride is typically prescribed to male patients. We do have patients that will start using finasteride as young as 17 years old because the patient has pretty much gone through puberty. Sometimes we will start a younger patient on a 0.5 milligram dose of finasteride, which is half of what is typically recommended to decrease the side effect profile of sexual dysfunction. The recommended dose for hair is a 1 milligram dose, which is taken every day. Anytime a patient has pre-existing hair, or you want to prevent additional hair loss, which is when we would prescribe finasteride to someone. You can also use a 5 milligram dose in a post-menopausal female who is undergoing thinning or hair loss, but not in a female who is of childbearing age. Finasteride helps to prevent hair loss by acting as a 5-alpha reductase inhibitor, meaning that it prevents the conversion of testosterone to DHT or dihydrotestosterone. And DHT is what we call the bad player. It's because that attaches to your hair follicles and gives it a signal to become finer, weaker, and then eventually fall out. The side effects of oral finasteride in less than 0.5% when compared to placebo is sexual dysfunction. Number one thing being decreased libido. There are really no sexual side effects with topical finasteride, although a patient may experience some mild tingling and or burning sensation in the first couple of weeks after beginning usage. A hair transplant patient would typically be prescribed finasteride to slow or stop the progression of additional hair loss. A hair transplant surgery will put hair where it's already been lost. However, it does nothing to stop or slow the progression of additional hair loss around the areas that are transplanted. So when we do a hair transplant procedure, we want to maximize the benefits of adding hair where it's been lost and turning around any miniaturized hair and keeping the existing hair for as long as possible.